Alright, so here we have a 60-year-old man presents to the emergency department with rapidly worsening shortness of breath that began the previous evening. He reports difficulty breathing when lying flat and waking up gasping for air. Over the past several days, he has noticed progressive swelling of both ankles. His medical history is significant for long-standing hypertension treated intermittently with medications. 3 days ago, he completed a long road trip lasting several hours with minimal breaks. Vital signs reveal temperature of 98.2, heart rate 102, respiratory rate of 26, blood pressure 176/104. Physical examinations show elevated jugular venous pressure, diffuse bilateral crackles with scattered wheezing, and a low-pitched extra heart sound heard best at the cardiac apex. There is marked bilateral pitting edema of the lower extremities. Chest radiography demonstrates an enlarged cardiac silhouette and prominent upper lobe pulmonary vessels. Which of the following best explains this patient's presentation? Okay, so here again, you want to take note of the patient's age. So 60-year-old man, right? He has difficulty breathing when lying flat. Okay, so that's orthopnea. Let's write that here, orthopnea. Okay, he's also waking up, gasping for air. So that's paroxysmal nocturnal dyspnea. So paroxysmal nocturnal dyspnea. Okay, now onto the next. You can hear bilateral crackles. So crackles basically just means that there's going to be fluid, alveolar fluid, right? So there's fluid in the lungs, basically, and this is like a transudative edema in the lungs, right? Because remember, the exudative one is the one that has to do with like infection or like cancer and stuff like that, right? While the transudative one is mostly about pressures, right? Because if the pressure on the left side of the heart is increased, it's going to back up to the pulmonary vessels, and that means that there's going to be increased hydrostatic pressure in the pulmonary vessels, and you're going to get fluids in the lungs. Okay, there's also an extra heart sound, so we're talking about an S3 gallop here, right? So S3 gallop, and remember that is due to volume overload, right? And the S4 is like, remember, that's if you've got like stiff ventricles, so you're going to get S4. Okay, we've also got peripheral edema, right? And there's a history of long-standing hypertension. So remember, this is a big risk factor for heart failure. So here we're looking at decompensated heart failure in this patient. All right, so now that make the answer C, right? So cardiogenic pulmonary edema. Okay, now you can also tell that this heart failure because again there's an increased cardiac silhouette down here. Okay, so that's another way to tell that, of course, this is heart failure. All right, now let's look at the other options. Acute pulmonary embolism. Now you would have thought that if you saw the whole long road trip thing, it's sort of like it's one of those things that you can throw into questions to kind of set you off. All right, so it's not that. All right, because for that you're going to get dyspnea, sudden dyspnea. You're going to get pruritic chest pain. Sometimes the lungs are going to look clear on radiographs, and also you're not going to find all the other stuff that's associated with heart failure, like the enlarged cardiac silhouette or the S3, stuff like that. Okay, then for B, exacerbation of chronic obstructive lung disease. All right, so COPD basically. Now for that you're going to be looking for a history of smoking, usually, not all the time, but usually. For that you're also not going to see cardiomegaly, right? You're not going to get the S3, you're not going to get the jugular venous distension either. All right, then for D, infectious pneumonia. Again, notice the patient's temperature here. So for infectious pneumonia, you're going to expect an elevated temperature, right? You're going to see focal consolidation, right? So for something for like lobar pneumonia, right, you're going to get consolidation on x-rays. So it's not going to be a clear x-ray. All right, and also infectious pneumonia doesn't explain the S3 gallop, right, or pulmonary edema. Interstitial lung disease. All right, so you're going to get this like fine crackle, like a velcro kind of crackle on physical examination, right? It's chronic, it's progressive, that sort of thing, but there's not going to be that cardiomegaly. Again, you need to just learn to like get rid of some of the options. You know, again, it's just going to help long term, right? Hypersensitivity reaction of the lung. You're going to need some kind of trigger, some sort of antigen, right? So exposure to birds, mold, farming, that sort of thing. And on X-ray, you're going to see ground glass opacities. All right, so ground glass opacities. All right, okay, see you in the next one.